This is our first podcast describing the results of a study that was done on back pain. The number of people with low back pain is rapidly increasing. There are two extremes of activity that seem most responsible. One are the extreme sports athletes. They make up about maybe 10% of the low back patients that I treat in the clinic and Nash trains in the gym. They're usually not at the level that they can make a living by doing skateboard and motorcycle stunts, but they see others do it and they want to push the limits. Much more common, making up maybe 75% of the low back pain patients, are people on the other end of the spectrum, the very inactive. This group includes marathon video gamers, binge TV watchers, and probably the largest group that I see are programmers and other workers who have to sit for a living. This being a podcast may catch the attention of more programmers than extreme sports athletes, so I chose to make this our very first topic. The title is Pain, Work-Related Characteristics, and Psychosocial Factors Among Computer Workers at a University Center. It was published in 2014, and the study was done in Brazil. They studied 10 males and 5 females who were relatively young, 27 to 35 years old, and had at least 6 months of work history using computers at least 4 hours a day. What did they measure? Just about everything you can imagine. Body fat, muscle mass, posture. They actually used a plumb and photographic measures of 14 different anatomic landmarks. This was very thorough. Just about every measurement of desk and bodies. They looked at the height, length, width of the computer, the desk, the chair, the eye, elbow, and thigh height, and the angles of the elbows, knees, and back. Some of the best measures of pain, including something called the Nordic Musculoskeletal Questionnaire, which you can Google and you can see it's pretty thorough. They looked at their pain going back a full year, mood and quality of life surveys, work motivation, number of breaks at work that were 5 minutes or more. This is important in looking for an association between sitting and back pain. If there is one, the researchers should see that the longer the workers sat, the more pain they experienced. They looked at the number of hours sitting in a day and at one time without taking a break. Also their sleep and exercise habits. What did they find? All 15 had pain in at least one body region. 10 out of the 15 had pain in the low back, but twice as many of those who had no rest break had back pain compared to those who did take breaks. 2 out of 3 people with no rest break had neck pain compared to none who did take breaks. None of the other body parts, including hands, wrists, or fingers, were affected by rest breaks. The use of a chair back only increased pain in the mid-back, where ribs are attached, not the low back or the neck. The group was highly motivated at work and had a pretty good quality of life. Quality of life was most decreased for those with neck pain. What does this mean for back pain sufferers? For one, these findings are in agreement with other studies that looked at how sitting is associated with low back pain. There was a recent article in Forbes magazine titled, "Is Sitting the New Smoking?" The title says it all. We often say that you're better off getting up and down for 6 hours a day than sitting non-stop for 2 hours. But there is another recent study that found that even though people getting up more often had less pain during their workday, their back pain after leaving work was about the same. This issue is important enough that we will dedicate an entire podcast setting to sitting. We'll look at different kinds of chairs and whether standing desks are a solution. What are the limitations of this study? This was very thorough, and I'm impressed by the many measures that they included. However, there was no direct observation of the workers. In other words, no one actually videotaped or stood there with a stopwatch, counting how long they were sitting or how many breaks they took. Another limitation that comes up in many studies is cause and effect. Were people who were having pain not standing more often because they were in pain, or was it the other way, that because they were sitting, they develop more pain. That's very hard to piece apart in this study. It was also a small number of volunteers, and they were studied on only one day. Some measurements could change over days or years. Also, they didn't study work on other devices, like laptops, phones, or tablets. How can you make meaningful use of this information? There are a couple of quick and simple things you can do today based on this study. Number 1, sit less. Even if you just get up to stand next to your desk and sit back down, that's something. 2, do something other than just sit. You can move your legs around, one foot out and back, then the other. You can do mini leg raises, or squeezing your thighs together, then pushing out against the arms of your chair, or do press-ups against the bottom of your desk by extending one leg out straight, lift it, and hold it against the bottom of your desk. Be careful with this one if you're currently having pain. You can keep a mini exercise peddler. We'll put something in the show notes that we like under the desk. My favorite sitting exercise is abdominal bracing. I think this exercise is important enough. We're going to dedicate an entire episode to it soon. But for now, we will have some show notes. Probably the best example of bracing is in the YouTube video that we'll put up in the show notes. That's it for this week. Thank you. There are 2 things that you can do today that can help us reach more back pain sufferers. One is that you can give us a healthy rating on the iTunes store. Those ratings matter, and it helps us find more listeners. 2, you can get a hold of us with your questions or comments. I know that I'm far from a professional podcaster, broadcaster, and I know there's a lot of room for improvement. You can talk about that. You can talk about content. You can ask questions, things that you think should be brought to the forefront. And then finally, the contact us resources. We do want you to get a hold of us, so we're going to give you just about every option possible. On Twitter, we're at Backtivity_org. Our email address is backtivity@gmail.com. The website is backtivity.org. Our phone number is 855-9-BACKTIVITY. That's 855-922-2584. Mailing address is 2885 Sanford Avenue, SW. Sanford is SANFORD. Number 35095 in Grandville, that's GRANDVILLE, Michigan, 49418. And finally, if you have the means to financially support our community, we're at patreon.com/Backtivity. All of these will be in the show notes. And please be patient. We're all very busy in our day jobs, and we'll do our best to respond to your questions. Thanks for listening. We'll be back in 1 week.